affects not only the treatment outcomes you deliver for your patients, but the options that you have and how smoothly your surgery life will be. The amount of support varies massively between different laboratories. And also, we want to look at how our patients experience and their perception of their whole journey from initial consultation to completed new smile. And I guess what we're aiming for is the situation where everything that we as clinicians and our patients would hope for and more will be offered by the same company. And with the support of the right laboratory, it's far easier for us all to offer multidisciplinary care. So using a laboratory that's flexible in its approach is integral to this. So firstly, a bit about me and my background. So I'm a GDP. I work in a practice in Barnsley in South Yorkshire. And I discovered an interest in orthodontics quite quickly after qualifying from Leeds over 30 years ago now. I did postgraduate training in fixed and removable ortho, but training that was aimed at general dental practitioners. And I used fixed and removable on the NHS for many years. With the advent of the UDA, we stopped offering NHS orthodontics. And in 2007, I first started using clear aligners. For the first time using a company called ClearStep. And I started working with S4S in 2009. And then shortly after Smilelign's launch in 2014, I moved over to them and I've been using them exclusively ever since. We offer Smilelign to our patients and we also advertise locally and get self-referrals. And we've used it and noticed a big increase in the growth of our practice and the profitability. Choosing to work smarter, not harder. I'm a platinum provider and have completed literally hundreds and hundreds of cases over the years. So the value of using aligners in your practice, it's just another tool in our armory to increase the variety of treatment options we can offer to our patients. Perfect occlusion is rare. Most of us have some form of malocclusion, but it's whether we can function and are happy aesthetically that really matters. We've got a rising awareness of improved aesthetics in our patient base, and demand is rising year on year for adult orthodontics. And the global market for adult ortho was estimated at $6.7 billion in 2023. Patients are more savvy. They know what is available and where they can access it. And they also understand more the biological cost of what I would call veneerodontics. We regularly get patients coming asking for align, bleach, and composite. They're generally not motivated by what aligner system you use. But yes, I do get patients coming in saying, do you do Invisalign? I just explained to them, it's an aligner system. I use Smilelign, which is a different aligner system, and I prefer it because. And hopefully this evening, I'm going to demonstrate to you why I prefer it and the benefits as I see it, and my patients appreciate it. As I said, my first experience with aligners was with this company, ClearStep, about 20 years ago now. And I'm still slightly scarred by that experience. And that instigated my hunt for a laboratory that would just do things differently. So ClearStep was set up by a consultant orthodontist in the UK called Andrew McLaren's. And he set it up to rival Invisalign. It was very slow, 3 times slower than Smilelign aligners work and twice as slow as Invisalign is. And so you'd get dozens and dozens of aligners. It was really complex. They advocated using posterior fixed appliances with anterior aligners. But actually, given that, I got some really nice results and patients quite liked it. And I still see my first ClearStep patients to this day for their routine dental care. Probably about 2 years after having started using them, things started to change. There was constantly somebody on the phone. They were hassling me to buy 10 cases up front and get 2 free, bigger discounts, the more cases you bought up front. They were signing practices up for Groupon deals where patients would get really treatment at a really reduced rate. And I hate that heavy sales technique in any walk of life. And so despite otherwise being quite happy with the product and the results I was able to achieve, it really put me off. And so I started investigating other aligner companies on the market. And I moved my my new cases over to Smiletree. And this saved me, well, it saved me a lot of money because in March 2013, ClearStep went bust, leaving hundreds of dentists with the unenviable task of continuing the care for their patients with a new company. So new impressions, back then there were no scanners, new treatment plans, new aligners, and new retention, all funded from our pockets. The patient contract is with us, and so we are in a situation where we have to sort them out. As I said, at that time I had 2 patients left in ClearStep, and I think it probably cost me £2,000 or £3,000 to sort that out, to put them through their new treatment plan and their new retention. But some people who'd signed up to these big group offers, it cost thousands and thousands of pounds. So 10 minutes on Google reveals just how many aligner companies there are in the UK at the moment. And this will just be the tip of the iceberg. But how many of them were there 10 years ago? I couldn't tell you. But more importantly, how many of them will be there next month or next year, let alone in 5 years' time when a patient wants a replacement retainer? What do they offer in terms of service, both to us as clinicians and to our patients? What ClearStep taught me in an expensive lesson was that if an aligner company stops sending you the aligners, then you have no treatment, and the book stopped with us to sort that mess out. So how does Smilelign differ and stand out in such a crowded marketplace? So skipped one, sorry. So Smilelign is the aligner system of S4S, who have 120 staff over 2 sites, one in Sheffield and one in London. Now, Sheffield is just down the road from me, and I'm a regular visitor at their laboratory, and it's massive. But not only is it huge and they've got loads of staff, but it's also the most technologically advanced laboratory I've ever seen. There are just banks of 3D printers. All work that we receive is produced in these 2 UK laboratories. They're fully digitally enabled and accept all intraoral scans at no extra charge. And currently they supply over 31,000 clients. S4S started in 2005, initially as solutions for snorers, offering a variety of snoring, sleep apnea, and orthodontic appliances. And Smilelign was started in 2012 and has gone from strength to strength. Their whole ethos is that Smilelign is a partner to us rather than just a product that we purchase. And this is what they're all about, to be the best in class, both in quality of service and the quality of their products. But that's all and well and good, but what do they offer that's different from the others? And after working with them for many years, I really do find that their customer service is absolutely second to none. So from before the patient walks into our surgery for their initial consultation to walking out at the end of the treatment, Smilelign will support us as much or as little as we need them to. Within the laboratory, they've got technicians with decades of experience, and they're more than happy to share that experience with us. I love the fact that I can just ring the laboratory and speak to the technician who planned my case, making the whole process as much of a collaborative effort as we, the clinician, want it to be. In the rare case that your patient's malocclusion is really out there, we can talk through the options with the technicians, and they've got experienced clinicians and consultant orthodontists at hand if need be to give us their take on their case. I guess the first building block in supporting clinicians is an education program. So although there's no mandatory training required, there are not only face-to-face seminars in the most amazing venue in London with practical hands-on sessions, and I shouldn't mention, but I always do, that they also do incredible cakes, but that's not just the only reason to go on the course. But there's also an online version that could be done in your own time. There's also the Smilelign Academy, a library of useful information, of which these are just a few screenshots showing some of the videos on offer, covering the most frequently asked questions from both clinicians and patients. So if there's something you're unsure of, it's likely that on the Smilelign Academy there'll be a video on just that topic. There are also clinical videos showing how to place an attachment, how to do IPR, and how to talk to your patient about aligners, and these are freely available for all providers. An important part of the training is how we can discuss and market aligners to aid that discussion. They've produced a professional presentation that's available to all providers that explains to our patients what it's all about, how it works, what they can expect, all aiding the consent process. So this is a small part of it, but as you can see, it informs our patient about IPR, attachments, cleaning aligners, and everything else they need to know. The better our patient is educated, the better they understand that aligners only work when they're in your mouth, the quicker and easier their treatment will progress. And this helps to get that message across quickly and effectively, so they know what they're letting themselves in for. The full presentation is available on the portal and is designed such that it can be used by a clinician, a TCO, a nurse, or even as part of aligner marketing within the practice. So once our patient has decided that aligners are for them, we're provided with sheets that guide us to understand exactly what will be easy to correct with aligners and what will be more complex, and depending on the amount of crowding or spacing that our patient presents with. These cover all different types of malocclusion, and we can choose whether it's just the simple cases that we want to treat and refer out the more complex ones, or whether we're wanting to take on even the most complex multidisciplinary cases with maybe pre-treatment, with conventional removable appliances, possibly crown lengthening or post-treatment restorative options, depending on our particular patient. And this is where working with a full orthodontic laboratory really comes into its own. Those complex cases that many aligner companies would struggle to correct fully can be evaluated with the possibility of pre-treatment with removable appliances, for example. We've got the benefit of years and years of orthodontic experience at our disposal within the laboratory, and we'd be foolish not to take advantage of that. I should also say that they're not afraid to suggest if you shouldn't touch something with a barge pole if that's the most appropriate thing. It really is a team effort, and they're our partners in this. If aligners aren't appropriate, or if a patient thinks they would be better with fixed appliances, there's always the Smile Fixed option with self-ligating brackets and indirect bracket placement, which has been developed with Amajol. If a particular case will benefit from restorative options following their aligners, it's also possible to ask them to produce a digital wax up from the final aligner model. So before a patient even starts their aligner treatment, not only can they see the effect of that aligner therapy, but what their post-restorative appearance can potentially be. So, as I've alluded to already, communication and education is an integral part of successful aligner outcomes. That's communication and education of our patients, so they understand the main factor affecting the success of their orthodontic treatment is them wearing their aligners full time. We need to understand what our patients' expectations are, ensure they're realistic and achievable, and then communicating these desired outcomes to the laboratory so they can plan our case. Presenting that treatment plan to our patient, maybe comparing two treatment plans. For example, if a patient's got an in-standing premolar, you can ask the laboratory to give you two plans, one to leave that premolar where it is and one to bring it into the arch to fully correct. And the patient can see the effect that's going to have on the time that they're going to be in treatment, the cosmetic effects, and the cost implications, and they can make a really informed decision. And that's where the Smile Genius portal comes in. So communication between us and the laboratory, and then through the app to the patient. So everything's in one place. If our patient decides to proceed with treatment, you're going to be able to see exactly where they should be in their treatment. And you can review it if they upload photographs for you. And it's cloud-based, so we can access anywhere on any device. The 3D viewer helps our patient understand exactly what the end result will look like and where attachments are going to be placed. I always tell them that they're tooth-coloured and they're not green. You don't want anybody thinking they're going to have green attachments on for the longevity of their treatment. But you can also see where IPR is going to be placed. And the most important thing, they get to see what their final result will be. This 3D treatment plan can be shared with our patient through the patient app. And so they can become our best marketing tool, showing this to family and friends, and they can explain what procedure they're having done, and these are going to be the final results. If a patient's proceeding with treatment, we're provided with consent forms covering everything that they need to know from an aligner perspective and a retention perspective. And I always tell patients that this is the most important bit. If they don't retain, we're going to be having this conversation in a few years' time. Now, Smilelign aligners arrive with a very cleverly designed presentation box and a slider box for us to keep in the practice with the remaining aligners in. And all this is turned around in just over a week. The cases are couriered to us with a tracking number that's on the portal, so we know exactly where our job is and can be confident it'll arrive in time for our patient's appointment. And each case comes with a goodie bag for patients with small gifts. There's a spray, a little mirror, and some lip balm, as well as a box to keep their aligners in when they're not in their mouth. But underneath that is a QR code with links to an information package which goes through information about wearing, cleaning their aligners, and there's a frequently asked questions section. In the slider box, it's easy to tell when it's going to be a straight aligner swap. The aligners are in a white packet, and when you need to do either some IPR or new attachments to place because they're in a peach packet. Obviously, the peach ones, the patches, the patient needs to be in the practice when that's going to be fitted. And the peach bag signals the need to check the portal, which I have running in the background on my PC in the surgery. So we can see whether it's IPR that's going to be placed or just new attachments. It looks really complicated on this screen. This is showing all 3 IPR sessions for this particular case, but it's quite easy. You just untick the cases that you aren't doing. So if we're placing IPR with the first aligner, it's just that top box that would be showing, and you would just see the IPR to be placed at that case, at that point in time. And then on the Smilelign app, patients get reminders when to change their aligners, and it allows them to take photos so we can see how their treatment's progressing as well as them, because they come up on our portal. There's also a link to online booking if you want to activate that, and a messaging option in case they have any problems. So why do I have a slide about bruxism and parafunction in an aligner webinar? Well, parafunction is something that can become evident at all points in treatment, whether it's when you first take in a history or when you're changing aligners and you notice wear on them. In very rare cases, without special treatment, if parafunction is so bad, aligners can be smashed to bits in the 2 weeks that they're in the patient's mouth. Now, this is less of an issue with Smilelign's ultra-thin Duratane aligners, which are 3 times stronger than standard aligners, which is incredible at only 0.8 of a millimetre thick. But S4S are experts in parafunction, so working with our technician, we can cope with whatever issues our patient throws at us, from discluding elements incorporated into active aligners to a multitude of solutions for long-term retention in a bruxist. And at the end of treatment, providers have the benefit of discounted rates for Vitalis whitening, which if you haven't tried, I would definitely recommend. We've had some incredible C4 to bleach shade results that have blown me and the patient away. Rather than involve another supplier, with Smilelign, we get the benefit of having everything under one roof. And from personal experience, it appears to have less sensitivity than other brands too. For whitening in aligner or orthodontic cases, they provide armadillo trays, which are hard on the outside and have a soft interior like a traditional whitening tray, which means no loss of retention if a patient's night whitening. There's also the choice of day kit, night kit, or a mixed kit, which patients seem to really appreciate. And the fantastic packaging all adds up to that premium feel. Now, if that's not enough to show you that Smilelign is different, then the marketing support on offer should seal it. S4S's marketing team consists of 5 full-time marketing staff plus a videographer, all of which will help you with anything they can to help promote any of their products in practice. From signage templates for social media and websites, pull-up banners, practice information leaflets. They have Stevie, their business development manager, who will do lunch and learns so your staff know how to talk to patients about aligners. They provide demo models so you can show patients what attachments look like and what an aligner feels like. And they also do direct to customer marketing on social media and have a find a provider spot on their website. The marketing team also offer end-to-end planning support for Smilelign open days. With the help of S4S, we've recently done an open day. As you can see from these leaflets, it was only a couple of weeks ago. For us, that involved 2 clinicians coming in on a Saturday morning. It was so popular that we had to open appointments up the following week. And in total, we had 19 potential new aligner cases. The S4S marketing team helped with our promotional strategy. They helped with workflow organization, ensuring everything ran smoothly on the day. They also do dedicated lunch and learns to prepare the team, ensuring everyone feels confident, fully informed, and ready to engage with patients about the products on offer. And give personalised offer to the practice and to patients, adding extra value and incentives for patients to attend and then to proceed with treatment. With bespoke marketing materials in the form of physical leaflets and posters, as you can see on the slide, but also social media templates tailored to your practice. They really did assist us with every detail, even to the point of making things to make the day memorable and take the strain out of organising it within the practice. So we had cupcakes for patients and Smilelign balloons. Although I have to say that the balloon arch was down to our nurses. I'm very, very proud of it. They were too. All in all, the open day proved to be an absolute game changer, bringing in so many new patients, boosting the uptake of treatment plans, and bringing in increased revenue. So, to end the webinar, I thought I'd show you a selection of cases that I've done with Smilelign over the years. First of all, Alison. So Alison had a bilateral osteotomy as a child with fixed appliances, but wasn't offered any retention. She'd got uneven anterior spacing, which she absolutely hated, but she also wasn't happy with the shape or the colour of her teeth either. She got moderate lower arch crowding, and without being able to offer some form of orthodontic treatment, I don't know what I would have done other than refer her elsewhere. So on the left are her pre-treatment models. As you can see, she's got missing teeth on the upper right. These spaces were filled with an acrylic denture, which was also on her wish list to replace. And it was critical to her that the space at upper right 4 was filled during treatment. So the plan was to redistribute the anterior spacing evenly to allow for composite or porcelain veneers post-treatment. The space, the upper right 4, we filled by putting a void in the aligner, which is then painted internally to match her dentition. And it's you wouldn't know they've not got a tooth there. She was really happy with it and accepted that when she was eating, when the aligner was out of her mouth, she'd have a gap. But whenever the aligner was in her mouth, that space was filled. So she required 10 upper and 10 lower aligners and actually had no refinements. And this is just what happens when patients wear their aligners. She had to keep her aligner in her mouth in order to not have a gap. And when that happens, aligners just work, and amazingly. So just 6 months after starting, this is the final result. Following a Smilelign treatment, she whitened her teeth and I improved the shape of her anteriors with composite veneers. She also had a bridge on the upper right to restore the spaces previously filled with that acrylic denture. Now, Alison works in a local store and is a wonderful, vivacious lady who's always smiling. To be fair, she was always smiling before, but even more so now. And we've had no end of patient referrals from her. Most of them don't know her name. They've just gone into the shop, commented on her lovely smile, and Alison, being Alison, has told them exactly why she's got a lovely smile and where she got it from and sent them our way. We could do with a few more Alisons really in our practices, I think. Now, not all cases are suitable for treatment just with Smilelign, or if we can treat with just aligners, it might take forever. And this will be the case with Louise. If I'm unsure whether a case is suitable for Smilelign, I'll initially get a model, which I can then discuss with the technician in a digital form and formulate a treatment plan prior to them looking at aligner options. So as you can see, Louise has got bilateral crossbites due to a really narrow upper arch. The only teeth not in crossbite are her central incisors and her upper right 2 and 3. And clearly correcting this all with aligners is a really big ask. I suspect if you send a case in like this, expecting it to be corrected with just aligners, I would expect to get a call from the lab. Now, all cases are pre-assessed prior to any cost being involved. So if you send something in like this with the intention to treat with just aligners, before any costs are involved, they'll give you a call and discuss what your options are, whether that means doing pre-treatment or whether just referring elsewhere. And so you're not hit with a bill for them just to say they can't do anything. So prior to Louise's treatment, we did a mock-up from the study models to give her an idea of what could be achieved. And the plan was to use an upper removable appliance like this, with a midline screw and cuspal coverage on the posterior teeth, and a Z-spring on her upper left 2 to push it over the bite. And Louise was told with no uncertain terms that wearing is going to be hard work. She's going to lisp a lot. She's probably going to drool quite a bit to start with. I always tell them they're going to hate it, as I really don't want anyone telling me that I hadn't told them what a mouthful it would be. So these are the models from the pre-treatment mock-up. And I'm just using these to give her an idea of where we're going. Because the difficulty with a case like this is until you've done the arch expansion, you've got no clue how many aligners you'll need to complete the case. And your patient needs to fully understand this before they start. So I fitted a URA and the following day got a call, and she was really struggling at work, especially when on the phone. And she thought I was exaggerating when I said it was hard and had realised that I wasn't. But I saw her after a month and she'd really persevered with it and was much happier. So Louise wore that URA for 5 months. The middle scan shows what was achieved in this time, and you can see how much wider that upper arch is. And also how much the lower incisors have aligned, even though we've not actually done any treatment in the lower, just because we've moved the uppers. So a new scan and a definitive treatment plan was formulated. And the plan was for 16 upper aligners and 3 lowers. Once again, no refinements were needed. Now, with cases like this, when they've had a URA, these patients are incredible aligner patients. After having a mouthful of plastic, just having 2 aligners in there is an absolute joy. There's no way they're not going to wear them. So they work beautifully. And here are her before and after photos. And I just love how much more confident her smile is on the second one. It's completely changed her appearance. I really do think we're in such a privileged position to be able to offer our patients these treatment and see the impact it has on their lives. So Hayley came in as a consult, and you don't really have to ask what her issues are. It's pretty evident from that smile. She'd also got quite a triangular shaped arch with way over 6 millimeters of anterior crowding, but her posterior teeth were in quite a decent position. It's just really narrow in that premolar region. So with Hayley, we looked to remove a lower central incisor, and then use an URA in the upper to get anterior expansion prior to aligners. And this is the kind of URA that we used. Again, telling them that they're going to dribble, they're going to lisp, and they won't be able to speak properly for quite a few days until they get used to it. But it speeds up treatment massively, and especially with these fan appliances are so quick. So she was turning it on twice a week, and the back doesn't move. It's just the anterior segments that get wider. So I saw her after 4 weeks, and I was blown away by how much space we got. So we make an Essex retainer to hold everything, while we then replan the Smilelign from this point. So on the left, you can see where we were before pre-treatment, and on the right, after 5 weeks of expansion. And this is what she looked like at the end of treatment. So she had a pre-treatment, aligners, and then whitening and some composite bonding on her upper central that was a little bit chipped. What shocked me slightly as I was taking these photos, when she said that when we started, she really didn't think we could have improved her appearance, which I did think was quite scary, that she would go into it thinking that she was going to look the same afterwards. But she did a fantastic review. And there's a before and after. And every time I see that after picture, I just really wish I'd wiped the little bit of dribble from the right-hand corner of her mouth. But I can't turn back time to do it. Now, Lucy, when someone smiles like this, you always wonder what they're hiding. And that's what Lucy was hiding. And I'll be honest, I didn't think aligners were going to be for Lucy. I thought that it was going to be something that needed fixed. And I stopped doing fixed quite a few years ago, just because there wasn't a great deal of demand for it. So I got some models of Lucy, and I went off to see my local orthodontist to discuss what I wanted, because I knew this was going to be a multidisciplinary case. There was no way that ortho alone was going to sort this out. She's got far too much spacing and quite a gummy smile. So I went to see the orthodontist, and we discussed evening out the spacing, correcting a crossbite, bringing the upper left 3 down into position, but then crown lengthening to reduce the gumminess of a smile. At which point he said, "Oh, I think I could do that with Invisalign," which got me thinking. So given, I think with cases like this, we are the best people as general dental practitioners to do them where you need that multidisciplinary care. I went back to Smilelign and said, "Well, what do you think?" And so we initially thought about using a special attachment with an elastic to pull it down and a hook on the palatal aspect of the aligner. But to start with, started off with a conventional aligner and attachment, and it worked. We didn't need the hook and the elastic after all. And there's Lucy's after photo. And I just think, how can you not love our job? You know, she was and is a different person. Her confidence was through the roof. And she said that she actually had to teach herself to smile again because she never showed her teeth. And when I was taking her final photo, she told me that she'd been doing a photographic log of her treatment, been taking pictures every week. And so I asked her to send me some copies. And this was it. And you can see, so we brought the canine down, but not fully into position, left it high enough. So then with some crown lengthening, we reduced the gumminess of her smile. And then she had composite bonding to fill those spaces out. And then lastly, lovely Anna, who had toyed with thoughts of having ortho for years. And then the thought of being 50 pushed her to actually doing something about it. And this was her 50th birthday present to herself. So Anna had got a very narrow triangular shaped arch with upper and lower crowding. Once again, that's a lot to correct with just aligners. If you look at the width that we need in that canine area, she's so narrow. So we looked at, again, to use a fan appliance in the upper, and in the lower to use a lower removable with a midline screw. And I worked in a school, so we started treatment as the kids broke up for the 6 weeks holidays, reducing the time she'd be wearing them at work. And once again, we got a plan to show her, give her an idea of where we were going. So she had upper removable with a fan appliance, a fan screw, and a lower midline screw, and in just over 14 weeks. So I think the upper appliance was in for about 8 weeks. When we got enough space for that, we put her in a retainer, as just an Essex retainer to wear as an aligner to hold everything while the lower arch caught up. The fan screws are so much quicker than the midline screws. With her, the molars are in the same place. So we're just getting that space in the anteriors. So after 14 weeks, we rescanned and we get an accurate plan, and she required 11 upper and 9 lower aligners, and then just 4 end of treatment refinements. And once again, an incredible patient, because she was used to having 2 massive pieces of plastic in there. And this was her final result. I would dearly love her to have a little bit of composite bonding to reduce that black triangle, but she's absolutely not bothered. She's more than happy and grinning from ear to ear. And once again, she said it's changed her life, and she wrote us a fabulous review and hands out recommendation cards left, right and centre. We've had most of the school management team in at one point or another. So in conclusion, I'm going to finish with a slide that I used earlier. For me, the main things that appeal to me about using Smilelign is the support I get from the guys in the lab, whether that's just a discussion about different ways to treat a case or taking advantage of their wealth of experience. It's great just to be able to give them a call and discuss it with them and use that experience. And they can help us plan and execute a successful open day, or give us marketing ideas and templates to promote their services that the practice offers. Patients appreciate the design of the app and the fact that they can see their smile before committing to treatment. Plus, they like the premium packaging, so they're not just leaving on the day their aligners are fitted with their aligners in the mouth and that's it, but they get a kit that supports them in their aligner journey. There are no upfront charges, there are no gimmicks, and you're just dealing with nice people who know their stuff and go out of their way to make aligner provision as stress-free as possible.